This news is funded by viewers like you. Please support our work at democracynow.org/give. United Nations Palestinian Aid Agency, UNRWA, is warning society in Gaza is, quote, on the brink of full-blown collapse as Israel continues its devastating assault that's killed 18,000 Palestinians in Gaza, including over 7,000 children. We turn now to a doctor in Gaza, Ahmed Moghrabi. He works at Nasser Hospital in Khan Yunis, one of the few hospitals still functioning in southern Gaza. We reached him yesterday.
Hello, Dina. Yeah, I'm talking to you from the Nasser Hospital. It's in Khan Yunis, south of Gaza, where I'm working as a head of plastic and burn department. It's been 64 days since the aggression actually started against Gaza. I can tell you here, actually, I'm working since the beginning of this war. Actually, I'm so exhausted, so exhausted. 40% of the injured people from explosions are children. They are seriously injured. Actually, this morning, I'm working since early morning till midnight, every day. We are here at the hospital. Actually, it's like a siege. All troops around us. What is going here actually is a real massacres all over around. If you see the pictures and the videos, actually you'll be shocked. There is no words can describe what is going here. What is going here actually is a real genocide. You know, hundreds and thousands of people actually are passing away every day because of these attacks. They are attacking schools, they are attacking church, mosques, civilians areas, everywhere they are attacking. Oh my God, I can't describe what is going here. It's a massacres. What is going here? The entire families are whipped out actually. I don't know really. I'm actually I developed like psychological disorder to see these children actually are, you know, how to say it, like how to say, are it's I don't know how it's they are burned till bone. They are burned till bone children. If you see my page, you will see all these, you know, horrible. It's horror. What is going here? My God, I hope this will end soon. Anybody, I don't know if anybody could help us. If you hear me, actually, I thought we are alone here in this world. We are living in big prison under strict siege, actually, and nobody listen to us. Nobody want actually to how to adopt our Palestinian narrative. Actually, everybody listen to Israeli narrative. Just listen to Palestinian narratives. We are here living under strict siege in a big prison. We are human being. Me, like you, I'm a human being. I want to live in peace. I want a better future for my children. Really, that's I want. I want. You know, actually, Israel supported by the whole world. You give Israel these mass destruction weapons, but in the other hand, nobody gives us even food. Here I can't find food, clean water. Me as a surgeon, I can't find clean water to drink. I can't find food. I eat only once a day, Dina. Yes, once a day. I can't afford my children food. I can't see my children because I can't provide simple, you know, food for living. I can't provide this food to my children. They eat once a day, simple rice. You know, my little daughter yesterday, 2 years old, she asked me, an apple. There's nothing here. We are dying from starvation. From everything we are dying now. All over, actually, they send these rockets over our heads everywhere, every time. Please stop this war against us. Please stop genocide against us. Stop this war, please. I beg you.
Dr. Ahmed Moghrabi, who works in Nasser Hospital in Khan Yunis, which was one of the few hospitals still functioning in southern Gaza. We end today's show with Dr. Tarek Loubani, emergency room medical doctor who works at the London Health Sciences Centre in Ontario, Canada. In 2018, Dr. Loubani was among 19 medics shot by the Israeli military in Gaza. In October, he was arrested for nonviolently protesting for a ceasefire. He's a Palestinian refugee, a member of the GLIA project, creating open-source medical devices for low-resource settings. You hear your colleague in Nasser Hospital talking about not being able to feed his own children, not to mention what's happening in the hospital. Dr. Loubani, you're in constant contact with medical staff in Gaza. Tell us what you understand at this point.
What Dr. Ahmed's saying is exactly what we're hearing all across the Gaza Strip from the hospitals there. Really, the situation, it's not teetering on, verging on collapse. It has, the medical system has fully collapsed. And the only reason we are using these words to mitigate the devastation and the absolute collapse is because the absolute bravery and incredible resourcefulness of the Palestinian doctors, who have done just an amazing job trying to provide care for their patients. These are people, these are doctors who themselves, like you said, are starving, literally starving. They themselves are getting killed, are being arrested, or having their families harmed, and still they show up to work every day like Dr. Ahmed does, bravely, and to face a new day of horrors.
Are telling doctors to leave their patients, particularly in northern Gaza, and move south. Also, doctors like the head of the hospital in northern Gaza are being arrested. Can you talk about what you understand at this point?
The arrests are a new dimension here. You know, we've always been used to a doctor here and there being killed. However, we've had over 250, I think it might even be up to 300 now, healthcare workers who've been killed during this war on Gaza. As well, Dr. Mohammed Abu Salmiya was one of the first arrested, but I can tell you the story of one of my students, a young doctor who graduated only a couple of years ago, who I've been teaching throughout his residency. He was an emergency medicine doctor. And he was, in fact, a valedictorian, Saleh Alewa, the highest ranking student in his medical class, a delightful human being who had never stopped smiling and then was arrested because he wouldn't leave his patients until it was too late. He was at Al Shifa Hospital. That's the story. His story is one of 41 stories that we have so far. Only a few of them have been released since. What the people who have been released tell us is that they are being tortured right now. They're being, quote, interrogated. And I know this because I've been in Israeli jails. I've been interrogated in those ways. I've been tortured. I've been beaten. And so I know what they're experiencing. And that was for me as a young Canadian. Now, what, mind you, these people who the Israelis want to see confessions from, who the Israelis are convinced are doing bad things, despite the fact that all they have done throughout this war and ever is take care of their patients.
Dr. Tarek Loubani, if you can talk about the warnings that the death toll could be dwarfed by those who die of diseases now, with the lack of clean water, the close proximity of everyone now being pushed south, diseases like diarrhea, scabies, measles, meningitis, acute viral hepatitis. What do you understand?
Before this war, the hospitals in Gaza were full because things happened to people day by day. And now those chronic diseases, the people with those chronic diseases like diabetes or diseases that need medications or cancers, those patients are all starting to die. It's been 2 going on 3 months now that they haven't been able to receive proper care. And that means proper medical care. Now, the foundations of life aren't proper medical care. Their water, their food, their psychological safety. And so people are starting to die from those things as well. We've already had our first starvation deaths. Predictably, they're in the very young and the very old. And as time goes on, we will see these deaths start to come in from the margins, come in from people who are sick and vulnerable to everybody. Because right now, the normal Palestinian in Gaza has not been able to eat or drink for weeks, if not months. When we're talking about the treatment of many of these problems that they're facing right now, the treatment is proper food, it's rest, it's clean water, and those things are not available. So yes, the predictions right now is that in the next few weeks, it'll be like falling from a cliff, and we'll see 20, 30,000 people dying.
Dr. Tarek Loubani, I want to thank you for being with us. Canadian Palestinian emergency room doctor joining us from London, Ontario. Spent years traveling to and working in Gaza. Democracy Now! Produced with Renee Fels, Mike Burke, Dina Guzder, Messiah Rhodes, Nermeen Sheikh, Maria Tarasena, Tammy Warnoff, Trina Nadura. I'm Mimi Goodman. Thanks so much for joining us. Democracy Now! Is funded by viewers like you. Please give today at democracynow.org/give.